You good, Grace? All right, so I'm going to move on to number 12. Let's see. Adoption of an ordinance of the City of Yuba City imposing a ban on the establishment of needle exchange programs within Yuba City.
Through the mayor, I'm on the board of Harmony Health, and I'm already very familiar with this particular project. So, I consulted with our city attorney, and out of a stream of caution, I'm going to recuse myself on this particular item.
All right. We're going to go ahead and start with public comment. Tricia, there's 4 of them that we're going to read. We received comments from, looks like about a dozen other people as well. We have 4 that we're going to read. Would you like a break from reading? We don't mind taking turns over here.
No, we're okay.
You sure?
Yeah. So in essence of time, the emails that we received, you guys all have copies of them. So I wasn't going to read those unless you want those read.
Well, you have 4 that you've made a different
The other ones,
color.
yes.
So
And
that's
then
the
I've
ones I'm
received
asking.
one more on the computer.
All right.
So, yeah. Okay. So the emails that you have in your possession that you'll be able to read, I'm just going to read the names for the record. Lindsay Wingate, Janine Johal, Rachel Farrell, John, Chris Weinberger, Matthew Jackson, Courtney Marr, Troy Flaherty, Scott Sorensen, Kevin Cotter, Lisa Abbott, Colleen Morris, and Richard Cray. Those are the emails that we received that you have copies from them. And then the public comments that we have. The first one is from Christopher, and I believe it's Melcher. Pardon me if that's not correct. Esteemed council members, I am writing on behalf of a colleague working for the Yuba City Harm and Reduction Community Outreach. It is my understanding that the council intends to review the program and potentially ban all syringe exchange programs after citizens have voiced concern about the organization's impact on the community. I would like to implore the council to seriously consider all evidence presented in favor of keeping syringe exchange programs. The common misconception that needle exchange sites promote or even encourage dangerous drug abuse is completely unfounded and is refuted by both national and regional data. Anecdotally, I would also like to share my experience volunteering with a similar program. In 2003, I had the opportunity to volunteer with the local AIDS counseling center in Aachen, Germany, a city about the same size as Yuba City. While the center was primarily focused on HIV prevention, treatment, and outreach, it also implemented a syringe exchange program and safe injection site. Rising unemployment in the late 90s and early 2000s in the town had led to an increased heroin use and STI transmission, prompting the creation of the safe injection site. Similar objections had been raised by citizens, particularly those living near the center. However, the center was able to report almost instantly that not only did the site dramatically reduce the needle waste and related police calls about drug use and transient individuals in the area, they also discovered that a remarkable number of individuals sought rehabilitation through the center. Many smaller sized cities fear that safe injection sites are a big city solution to a big city problem. But just as the opioid crisis in the United States has spread to urban and rural areas equally, the solutions of harm reduction and outreach can actually prove to be even more effective and have a direct positive impact in smaller locales. Again, I hope you will consider the facts and resources presented by the Yuba City Harm Reduction and Community Outreach when making your final decision in what the best interest of all Yuba City citizens. Okay, now we have one from the CEO of the Yuba Center Harm Reduction and Community Outreach. There's no name, just the CEO. Did you know that in the state of California, it is illegal and unsafe to dispose of needles in the trash, even if in a puncture-proof container? SafeNeedlesDisposal.org states 9 million people use sharps outside of healthcare facilities every year for insulin, lancets for blood sugar, and other intramuscular injection medication. Yet there is only one location to date for safe sharps disposal in both Yuba Center counties. People are bringing needles into Yuba Center County already, and one person admits to bringing in hundreds at a time and distributes them amongst others. If that person does the distribution, we miss the opportunity for face-to-face interaction and connecting individuals to resources. We miss the opportunity to collect the syringes and dispose of them properly. People who have access to a syringe program are 5 times more likely to begin treatment. Currently, public health in both Yuba and Sutter counties do not test for Hep C, HIV, nor sexually transmitted infections. As healthcare providers in this community, we're asking, what will you do for our community to increase access to Hep C, HIV, and STI testing and treatment? IV drug use is the second leading cause of new HIV infections. What will you do to increase safe syringe disposal and reduce the risk of infections through needle sharing? Please approach these questions with evidence-based methods that have been proven to work. Let's meet together and discuss this. YSHRCO in partnership with Harmony Health. Thank you so much for your guys' time. All right, and this is Chris Weinberger. I sympathize with community members scared that needle exchange programs encourages IV drug use. That just isn't the case, though. Anyone willing to stick a needle in and inject themselves with deadly drugs is past the point of making sound health decisions. Addicts are willing to do whatever it takes to get their fix until they decide they want out of their situation. The absence of a needle exchange isn't stopping any addict from using drugs, but it does increase likelihood of sharing used needles, increasing the chances that they will transmit diseases like HIV and hepatitis C. Best case is that those needles go into trash, worst case in a park. Even in the best case, that's not a legal way to dispose of needles. A syringe service program will not only provide clean needles to prevent the spread of disease, it will also provide an avenue for safe disposal of the needles for everyone and an opportunity for volunteers to talk to them and get them into rehab. Studies show that SSP users are 5 times more likely to enter rehab and 3 times more likely to stop using drugs. The clinic will also be able to dedicate resources to clean up in the community. SSPs are needed as a step to help keep the community safe. It's not just for the benefit of IV drug users, it's for everyone. Consider allowing the YSHRCO to present more information to you before voting if needed. Thank you. And then we have one more from Elisa Rojas Pilato on item 12. I recommend to not ban needle exchange programs because sterile needles help people prevent transmitting bloodborne and other infections when they inject drug.
All right. Anything on the computer recently?
Just the one that I just read.
Oh, okay.
Yeah.
All right. Now we have an action. We can discuss it amongst ourselves to introduce the ordinance imposing the ban on the established needle exchange program. Anybody care to comment on that? I'm sure.
I guess
You don't
I'll
have
first.
to. I mean, if you're
No,
just
that'd be all right.
asking if you're interested.
That'd be all right.
All right.
Instead of waiting, I guess I'll jump into it. I've read everybody's letters. I've read the pros and the cons. And then I went up and got some information from Chico because they started the program. And the comments that I had from a few dignitaries and stuff like that, they said it wasn't a smart thing to do. They showed me pictures of the restroom facilities and has needles just piled up in the trash cans. There's in the parks, there's needles piled up. The city streets, there's needles everywhere. And they kind of didn't like the decision that they made was just from the two people that I talked to. So my comments and my thoughts, the lesser of two evils, I'm opposing this. I'm not for it,
Not for,
for the needle program, exchange program.
okay, but you are in favor of introducing an ordinance?
Yes.
Okay.
Yes.
Gentlemen?
Very brief comment. First of all, thank you for all the input. We do have to weigh the pros and the cons, but I will echo the sentiment from my fellow council member here. All you have to do is look north. And Bidwell Park was completely covered with needles to where it was unsafe for people to be in the park. I was recently sent a video of how they were getting disposed of in bathrooms, porta potties, all kinds of stuff. It good intentions, but it endangers our general health and well-being of our population, in my opinion. We have to think about the kids that will be at the soccer fields, the kids that'll be at the park. When you go down towards the river and such, like we have the 4th of July, those are my concerns, and I have to look at the well-being of our city as a whole. And I encourage the proponents of the program to further look at other ways to not only curb the exposure to HIV, but the bigger picture is we need to get these people off of their addiction, because that's how you're truly going to stop the spread of HIV and Hep C and everything else, is they have to stop using. So I would encourage them to refocus their efforts on getting them to be drug-free, not just exchanges.
Concur with both of you gentlemen that I do consider it a health and safety issue for our community. The thought of, I've seen the photos as well, not only in Chico but other cities of syringes laying around for anybody to potentially step on, or children, and it just there's got to be a better way. Of course, I want everyone to not do drugs, of course, and participate in safe practices where they're not getting HIV, Hep C, everything else. But I don't think it is critical that they won't do it if we enable them by using the syringe as a carrot to get them into our office to talk to them about it. There's other ways to get the message out to them. And it's particularly when the literature I've read, the proposal here locally, it's not an exchange program. They're just handing them syringes. They don't have to even give one for one, and that's how they end up in dangerous, disgusting situations to where it just pollutes our community and affects our health and safety. I would say the folks that are running the programs that try to curtail the spread of disease and safe practices find other ways to contact the folks that are in the unfortunate position to be addicted, and give them the help that they need. And I certainly hope that does so, that they get it. But I don't want to do that on the backs of our safety of our community. So, excuse me, sir.
Thank you, Mr. Mayor. I too want to thank the many people who have provided comments, both pro and con, to the program. I do think that it's probably well-intentioned. However, the consequences of what's left over from these good intentions, I do believe poses public harm. As it relates to being able to check folks for STIs, HIV, Hep C, et cetera, I think there could probably be alternatives to that versus this program. And as the mayor pointed out, this really isn't an exchange program. It's you're handing out needles. So at this point, I'm in favor of introducing the ordinance banning this program.
I'll second that.
Apparently you just did. All right, all those in favor?
Excuse me,
Did
Mayor,
someone have
there
a
was
comment?
one other comment.
All right, thank you.
Okay. This is from Kelly Walsh. And good evening, City Council members. I would like to present my comments regarding the agenda item 12, the introduction of the ordinance banning the establishments of needle exchange programs in Yuba City. The Yuba City staff report on the agenda item lists several concerns, all regarding used needles. Of course, all of these are important considerations. However, another equally important concern is the health and safety of the people who utilize those needles and the community members with whom these folks interact. There is plethora of research summarized by the Centers for Disease Control and Prevention showing that needle exchange programs do help people stop using drugs while reducing infections and even the presence of needles in public places while not causing or increasing crime or drug use. Here are a few other points gathered from the article in 2019. The first needle exchange programs in the U.S. was in 1988. 28 states and the District of Columbia now allow needle exchange programs. Governor of Indiana, Mike Pence, allowed a limited needle exchange programs in 2015 after an HIV outbreak. The Republican-controlled legislatures in Idaho and Georgia have passed bills to allow needle exchange programs, and Florida, Missouri, Iowa, Arizona have introduced needle exchange program bills, all sponsored or co-sponsored by Republicans. The staff reports of Sutter and/or Yuba County were not included in full in the materials for tonight's meeting. Thus, I am not addressing those reports. In closing, an opportunity has presented itself to consider a research-based program that can help improve the health and safety of our community. My hope is that this council, with such deep beliefs and commitment to service, inspires our community to humbly contemplate the proverb, "There, but for the grace of God, go I." Thank you, Kelly Swanson, Yuba City educator and credentialed school counselor.
Okay, thank you. Did that come in via email or was that?
Yes, it was a public comment email. It got lost.
Oh, all right.
I've got
That
quite a bit up
explains the
here, so I'm
confusion.
sorry.
All right. So we have a motion and a second. All those in favor?
Aye.
Aye.
And opposed? None. Okay. Although I thank for everybody's input. On the other side, are you going to go get it, Grace?